Good day. This is Renisha Bowens. I'm a member of the Health Information Technology team, and in this training video, we will be covering labs, procedures, and diagnostic imaging documentation. We're starting in our progress note. Generally, our in-house labs include the standing order labs. Standing order labs cover HIV testing, urine dips, urine pregnancy tests, colon cancer screening, rapid strep test, etc., etc. Please consult with your nursing team to get the full list of standing order labs. To access standing order labs, generally you're able to order these without the provider approval if the patient meets certain criteria. We're going to start with the HIV testing workflow. This is probably one of our oldest standing orders. So for the HIV workflow, this actually requires several additional steps other than just ordering the lab. First, we need to check to see if the patient is even due for HIV testing. And to do that, we can access the CDSS alerts via the patient dashboard in the progress note or via the hub, which you can access through the patient lookup as well. When you open up CDSS, you want to make sure where it says My Alerts Only is unchecked. That way you can see all of the available alerts for your patient. So as you can see, down here underneath where it says Practice Configured Alerts, this is where we're going to look for the HIV testing options. So for our patient, if you see here, it shows when this was last done. So this says that it was ordered August 2nd, 2021, which means that it was not necessarily completed. Thus, the due date is showing as today's present date. Additionally, in the status, if you hover over that, red means non-compliant. So the patient is, in multiple ways of showing, due for HIV testing. At this point, you may offer the test to the patient, depending on what type of patient you're working with. If your patient already has HIV, you want to update the chart so that HIV testing is no longer part of the patient's alerts. To do that, we're going to click on the hand that says Suppress this alert, and we're going to click Never Remind. So if you put a check mark next to Never Remind, it's going to ask you why, and you can put patient with active HIV infection, or some other statement indicating why we're clicking Never Remind. If your patient is due for HIV testing or does not have HIV or AIDS for that matter, you can offer the test to the patient. If the patient says, I've gotten this done already this year, great. We need to document that though. So in order to document it, we're going to click on the H, which is for Enter Historical Data, where we can put in the last done date for the patient's HIV test. And that's only if the patient has gotten it done elsewhere at a previous date within the last year. So we'll put in the date it was done and the result, whether it was negative or positive. Please note HIV tests, the rapid HIV test and general HIV tests only come in negative or positive. Once you've selected the date done and the result, we're going to click OK to save that information. Okay, I'm going to click Cancel for now because we're going to assume that our patient is actually due for HIV testing. I'm going to click Close. Note this CDSS alert to check the patient's HIV status. This can be done at any point in your workflow prior to administering the test. So you can do it before you get the patient, you can do it during your intake, it's totally up to you. But that is how you access it. Now we're going to offer the test to the patient and say, hey, you're due for HIV testing. Let's go ahead and get that knocked out today. The patient can either say yes or no. If the patient accepts, we need to document it. If the patient declines, we need to document it. And to document it, we're going to put it into our chief complaint. So when I click on the enter keyword section, the third option says accepted HIV test, serum test needed. This is basically the patient saying, yes, I'm going to get the HIV test today. In the event that the patient declines, you can type decline in the keyword section, or you can use the arrows to navigate through. Totally up to you. You have decline rapid test, tested negative outside of Unity. So the workflow that we just did where we entered the last done and the result, that needs to be completed for this particular declination statement. The next one is declined age 13 to 18. So for this one, if a patient ages 13 to 18 comes in alone, you are allowed to offer the test to the patient. If the patient comes in with a parent or guardian, you are not allowed to offer the test to the patient. So you would automatically select decline rapid HIV test age 13 to 18. In the event that that parent or guardian does indicate that they would like that child age 13 to 18 to be tested for HIV, that is a conversation that the provider needs to have with the child. The next one is decline because of finger stick, denies risk factors, doesn't want to know, or other. Those are your declination options. But because we are training today, our patient will have accepted. And we're going to select accepted to pull it into the chief complaint. Note, this does not count towards your total counts for chief complaints. You still get 3. And that's in this case, the diabetes, high blood pressure, and breast cancer. We're going to navigate to our lab report section, which is this here. Looks like a test tube and a beaker. Alternatively, in the progress note, there's an actual link that is called lab reports. So I'm actually going to go ahead and close this and show you guys where that is located. We're going to scroll down to plan. And we're going to click lab reports. Okay, same window. First thing we're going to do here is change our type to in-house. And this in-house filters out all of those UHC and general LabCorp labs that are available for ordering but are not necessarily in-house labs. We're going to navigate down to our HIV test. And this is only if you're giving the patient the rapid test. If your site is only doing the blood work, then the provider will order the blood work. But if you're doing a rapid test, whether it's the finger stick or the oral swab, you would go through the in-house labs. And again, this does not require a provider order. If the patient is eligible for the HIV rapid test, please check with your nursing leadership to find out what those parameters are. To select the lab, we're just going to click on it. It is going to ask you to associate an ICD code. We are not going to do that, so we're going to click on the X to close this window. And under today's orders, you should see your ordered HIV test. At this point, we're going to click close. And you should see the HIV test listed here under lab reports. Now, if you have any additional labs that the patient needs done, like a urine dip or a pregnancy test, you can follow the same workflow. We're going to go to type in-house, You can actually use the search to filter out what you're looking for. So for instance, if we wanted a urine dip or a pregnancy test, we can select either one, whichever one it is we need. I'm going to go with the urine dip. Same concept here. We're not adding ICD codes. And you can add as many labs as needed that are standing order for the patient. So if the patient says that they think they might be pregnant, you can order a pregnancy test. I ordered a urine dip. I'm going to assume that my patient may have mentioned that, or they may have provided a complaint indicating that they're having some sort of urinary distress, which usually is an indication to complete a urine dip. The requirements for in-house labs being standing orders, you should be able to get that information from your nursing leadership or one of the eCW trainers. I'm going to click close to save my entries. And you'll see them again, like I said, down here in lab reports. Next thing we're going to look at is how to actually document these labs. And this is only assuming that you've already completed them. I do not suggest that you complete these and fill them out until after you've performed the test. You can order them before, but perform the test before you do your documentation. To open it, we're going to click on the link for the test. And then we're going to complete all of our mandatory fields, starting with the assigned to. Your assigned to is going to be the same as your ordering provider or the appointment provider. So for the assigned to, you can use the drop-down menu here and select whoever you're looking for. Alternatively, you can type in here either the last name or comma the first name, and it'll do a search as well that way. Additionally, you can use a staff lookup, which is, I clicked too fast, these 3-dot box here. It's called an ellipsis box, where you can search for various staff members, including providers, MAs, nurses, and other staff in the area. We're going to select A Unity because that is the associated provider in our assigned to. Underneath, you can see what your actual lab is, just so you can confirm that you clicked the right thing. Here we have our order date, which should be whatever day you entered it. We're going to look at the collection date. We're going to put a check mark here. Then we're going to enter the time. You can use the sliding slots here to enter the time, or you can click now. Works just the same. Source, depending on the type of test you're doing, you would enter the appropriate source. In this case, it'll be blood. Then we're going to go to this result tab here to enter our results. We're going to click received. We're going to click results, drop down, where we're going to put whether it was negative or positive. Again, HIV testing is either negative or positive. And you're also going to put it here in this yellow field under the name of the test, which is HIV finger stick. Again, negative or positive. Lastly, we're going to timestamp in the notes box here using the timestamp clock. In most areas of eCW where you're able to timestamp, you're going to see the little clock there. Sometimes you might see the actual word timestamp. So if you are doing some kind of documentation, you want to make sure you timestamp. When you click here, it's automatically going to pull in your name, the date, and the time. Then there's this little arrow right here which indicates where you're supposed to start typing, which is generally after your actual timestamp. And here we're just going to put in our lot number and the expiration date for the test. And that is all. We're going to click OK. And as you can see, our results pull into our progress note along with our timestamp notes. Okay, I'm going to go ahead and document the urine dip just so you can see a different version of a point of care test, in-house lab. Same concept. We're going to do our assigned to, collection date and time, our source. I'm going to go to the results tab. Now you'll notice this one's a little bit different than the others in that your results are not just a single negative or positive. You have a multiplicity of results that will come from your testing machine or from reading the colors on the tube. We're going to click Received. Result is going to be completed, saying that you did it. And here we're going to put in our values. Then we're going to do the same thing we did before where we timestamp. We put the lot number of the tube and the expiration date. And then we're going to click OK. Now the labs will automatically be sent to the provider to be reviewed and addressed by them. And that's how we enter our in-house labs. The next thing we're going to look at is documenting ordered procedures. Now, as you can see, we have a procedure listed already in our chart where the provider presumably has already ordered the albuterol solvent, which is a nebulizer treatment. Accessing this is exactly the same as we did with the lab report. So we would just click on it to open up the documentation window. In the interest of providing a little variety to your workflow, we're actually going to document this on the office visit screen. To access your office visit screen, we're going to click on the S Jelly Bean. As you can see, our patient is lit up green here, meaning there have been orders entered for the patient. So we're going to click on check mark here. We're going to click on view orders. Here's our current labs, ordered diagnostic imaging, and the procedure that we're going to document. So assuming that we're administering this albuterol now, we're going to go ahead and click on it to open it. Same window that we saw when we opened it on the progress note. Your documentation for the procedure is going to be a little bit different than the labs. Firstly, the assigned to is going to be yourself. Again, you can start doing an automatic search by typing names into the assigned to. You can use the drop down where you scroll through looking for the person's name, or your name for that matter, or you can use the staff lookup where you can search for your name that way as well. Next, we're going to jump down to where it says perform date. So instead of it being a collection date, you have perform date here. We're going to check that box, and we're going to jump to the results tab here. This is where we're going to check received. Result is going to be completed. Then we're going to jump down to this notes box here where we're going to timestamp and enter our actual note. So what did we actually do today? If you're unsure how to document a note like this, please consult your nurse or one of the senior MAs or your nursing leadership. For now, I'm going to go ahead and enter my note, which is going to include what was given, which is the albuterol, how much was given. You can actually highlight and copy and paste using the keyboard shortcuts into the box. So that's my what, my how much, and my route. Okay. I'm going to enter my lot number, expiration date, and at this point, if your patient has been discharged or the provider says, I'm not going to give them any additional doses, you can come up here to the top where it says reviewed and click the radio button for reviewed. If the provider says, hey, can you give an additional dose, the provider needs to document it here in the note section requesting an additional dose. Once you've administered it, you would timestamp again, document what you gave, how much you gave, lot number, expiration date, etc. And when the patient is discharged, again, you can click review. If the patient has not been discharged, leave it open, and then you can review it later. So our patient is done with this albuterol. I'm going to go ahead and click review so you guys can see how that affects the office visit screen. Once I click reviewed, I'm going to click OK. Note I clicked reviewed last. Do not click reviewed first before you start your documentation. Please click reviewed at the end of your documentation. I'm going to click OK. As you can see, the procedure disappears from the office visit screen. One thing to note about this particular screen is that it only keeps what it needs. So once something has been addressed, or locked for that matter, it will disappear from the office visit screen. And it's okay because the procedure is still located in the progress note as well. So if you really need confirmation that that procedure is still in the chart, you can actually go back to the progress note and take a look. And that covers documenting ordered procedures. Now the next thing we're going to look at, since we're already in the view orders, is how to document the EKGs. Now some sites are doing manual EKGs where you use the little manual box, big box EKG to get your printout and so on and so forth. And then you have others that are using the Midmark EKG machine, which integrates directly into eCW. The documentation is more or less the same, but I am going to show you how to use the Midmark software. So to access your EKG, if you're in the progress note, you would click the EKG in the diagnostic imaging section. In the view orders, we're going to go to where it says current diagnostic imaging. We're going to click on the EKG. And then we're going to do all of our documentation, starting with the assign to, which goes back to the ordering provider. Note, this is ordered by the provider, not by the clinical staff. Then we're going to jump down to where it says perform date, similarly to how we documented the progress note. We're going to go to result. And we're just going to change our result. From here, we're going to change the result to completed. If you are doing a manual EKG using the EKG box versus the Midmark EKG, you can check the receive button, basically saying that you received the results. Of course, you would timestamp indicating that you actually received the results. If you are using the Midmark machine, you do not need to check received. You can go straight down here to where it says Midmark ECG. And it's going to open up this box here. We're going to click where it says Start Test. You can use Start Test at the top or in the middle. As you can see, the height and weight automatically pre-populate. Same thing with the blood pressure. You can always go in and change it if necessary, but you can use the pre-populated information if need be. We're going to click OK. It's going to launch a Midmark Diagnostics group screen. You want to adjust the leads as necessary. So you have the screen will indicate whether there's an issue with your leads. You have a print, analyze, freeze, start RR, settings, help, exit buttons. When you see that you're getting your readings as desired, we're going to click the button that says analyze. You're going to see a pop-up. It came very quickly, but that pop-up basically said printing to the Midmark PDF converter. And what that does, it takes your EKG and it saves it to our servers so that it can be viewed by everyone accessing 11E. We're going to click review. And this takes us to our actual EKG report. From this screen, you can add your initials here to technician, or you can type your name. Over here in the results box, this will show you the results of the EKG, whether it was like a normal EKG or patient has ischemia or something like that. So it'll have additional information here. And at this point, if you wanted to print the EKG, you can actually click print and then hit print here. If you have a default printer set up, it'll automatically go to your default printer. Otherwise, I'm going to go ahead and click exit. Then I'm going to click this box that says OK, saying that it saved successfully. Then we're going to refresh here to get the results. Now, even though that pop-up said that the EKG was saved successfully, we're going to make sure we see it here. This is how you know that it was saved successfully in the 11E format. I have seen cases where EKGs say they've saved successfully, but they're still saved in the old eCW format, the old executable desktop version. So if you see it here, you know that it has been saved successfully. Additionally, just an FYI, the EKGs, if they're saved properly, will also save to patient docs under the diagnostic results folder. So if you did need to reprint it, you can reprint it from here, or you can go to the patient's documents and print it from the diagnostic results folder. Once you've completed it, you'll notice here that the receive box has automatically been checked. Of course, you'll do your usual timestamp. Just let the provider know, or EKG done, or whatever. Then we're going to click OK. Once we've closed the mid-mark window, it's going to bring us back to our diagnostic imaging window. We're going to click OK to pull in all the information, and as you can see here, it shows that the notes box has your timestamp and that it was actually done. Once you click received, done is automatically selected as yes. Okay. We're going to go ahead and click OK, and that's our mid-mark procedure. So we have gone over in-house labs, ordered procedures, and our diagnostic imaging EKG, and that concludes this portion of our training. Thank you and have a good day.